The coalition of NGOs in health says Ghana has taken its eyes off the management of COVID-19. According to the leader of the coalition, Dr. Gabriel Benaku, this has led to a spike in the positive cases that we're seeing within the past few weeks. Ghana has recorded an average of about 282 positive cases each day between June 1 and June 13, with a total of 16 infected persons dying from the virus. Dr. Benaku joins me via Zoom, so we have a quick conversation on this. Doc, thank you very much for your time this afternoon. Why do you say, or why are you of the opinion that government has taken its eyes off management of COVID-19 cases? When you say that, what exactly do you mean? Okay, Doc, I need you to unmute your Zoom because you're muted at the moment.
Okay, thank you. One critical sector that Ghana have not done well, if you like, the implementing agency, which is the Ghana Health Service, is the sociological aspect of the COVID-19 management. If you notice, since February, the coalition of NGOs has always been very loud and clear about why we need to involve everybody in the fight. In March, we praised the president for the political commitment and then the financial pronouncement. In April, we warned the country that please put in place mechanism that will decentralize the funding mechanism for Ghana Health Service to be able to do their job well. And we also warned that please make sure that our traditional authority and religious body are properly mainstream. We also came out with another survey suggesting that the Metropolitan, Municipal, and District Assembly have a critical role. As at the time the president lifted the partial lockdown, we said that the government needed to double out the effort being put in place and decentralize the response, create national control program on coronavirus. So these are critical interventions that has been relaxed. You matter how the presidential advisor will explain, we are on the ground and we think that we need to give them this information so that they can plan with. For example, if you are talking about contact tracing, there are so many institutions that need to help this contact tracing. Talking about the traditional authority, talking about the religious body, talking about civil society that already have the expertise. We have done that for HIV, we have done that for malaria, TB, talking about leprosy. So why are civil society not properly mainstream into the community tracing and community education? The next point is that stigma, we warned us at 22nd April that the Ministry of Information needed to involve the mental health authority, and the mental health authority already have mental health and psychologists in the various districts, so that they can be capacitated to play a critical role in anti-stigma reduction messages. They later initiated, but it is not trickled down to the communities. And therefore, you are seeing, and I have seen a lot of documentary you have picked from the community where so many people have been stigmatized. Our parliament themselves have self-stigmatized themselves. Other government officials have stigmatized themselves. And we create activities that do not allow us to go to the grassroots to be able to let everybody appreciate people who already have it and have been treated and they are discharged. We have not promoted advocacy. We have not promoted champions. We have not promoted ambassadors who need to really let Ghanaians know how it is, what one goes through, why we must all preach anti-stigma reduction in the various community. So the sociological systems and factors that we needed to fuel in to support Ghana Health Service and the Metropolitan Municipal District Assembly have not been much more integrated, and therefore funding has caused the whole thing. So what we are suggesting is that get the traditional leaders on board, support the Ghana Health Service to strengthen their system, increase the number of people who support the social, the contact tracing, and ensure that civil society have been properly integrated as we have done in the other public health interventions. If we do that, everybody will be alert, everybody will support, and everybody will begin to protect one and the other. And that we can really break down the chain of the pandemic.
Some people have suggested that we are not even testing as much. They say that because of concerns that have come from people who are supposed to be contact tracers, who say they have not had the remuneration promised them. And so they have, some of them say they have boycotted, they're giving up. What information is the coalition picking on the ground as far as the work of contact tracers is concerned?
Yeah, as part of our research, the equity distribution of access to testing is still inadequate. So there are two critical points here. We are supposed to have helped all the regional hospitals to be centers. And we are tracking the Ministry of Information, Ministry of Health, Ghana Health Service, who promised that they were going to calibrate the existing health facilities that have TB laboratories, that they can calibrate to ensure that all the regions can do their test and report. That we have not seen. We are still tracking when they will do that. But the truth is that we needed these testing centers in all the regional capitals. And even within the region, there are capacities within the region facilities, both private and public facilities, that you can allow the testing to be there. So we do not support the idea that you pick a sample and you travel over 200 kilometers before you can get the result. That is not a proper health system. So that is one. The second aspect is that we have our research centers. So far, apart from the few pronouncements we have seen pronounced by Noguchi and a few other, what is government doing about our research so far? You cannot come to the podium and just tell us about how the figures are increasing. But you need to tell us the science behind that and what the scientists are doing for Ghana. That, if you don't do that, the psychologists and the psychiatrists will not be able to package the messages that can calm down the depressional nature the country is going through, and that can also support the country in the role we all need to play, including the media. We need to have timely information. We need to have scientific information, as the ministry report that they are moving the country based on science and data. We are not seeing the practical nature of the science and data that they are talking about.
Okay, so lack of the practical explanation of the science behind the figures. You think that that's playing a part in the way people perceive the seriousness of this disease? Yes,
psychologically, I can change my behavior towards a particular practice if I'm empowered, if I'm educated, and if I'm supported. So the three things make a change. So you cannot provide superficial education that cannot move people to attitudinal change. And all that we are saying is that support the municipal, metropolitan, and district assemblies with the Ghana Police Service, together with the Ghana Health Service, including the social structures in every district. That is the traditional authorities, the religious body, civil society, and other recognized private institutions. Let them come together in a very transparent manner to agree that we want to do 1, 2, 3. That is not forthcoming. So, for example, if you pick a normal district assembly now, the attention and the intervention they rolled out a month ago is reducing. You can pick 2, 3 districts and do your survey. What it means is that we are not sustaining the effort we made 2 months ago. And so we are very reactive as a country. We only respond, and you know what it means. You declare Takoradi as a hotspot, but the necessary logistic you are supposed to give to Takoradi is not forthcoming. Then you will be there and it will move from Takoradi to another location. Let me give you a typical example. We had a recorded case in Wa, at the Upper West region. We warned that in addition to the Upper East and the Eastern region, government should do something about it. It has been relaxed for several months. Now you are recording very high cases in Upper West, for example. So what it means is that after we identified the case, we have responded and we have relaxed, and then the virus has gained root in the Upper West. So what kind of science are we interpreting, and what practical support are we providing based on the science and data?
Okay. So
you are not activating the social structures that need to support the science of the technical team. And so we continue to let government know that all is not well with us. We must not relax. They must be able to encourage, motivate, and that motivation is reducing.
Okay.
So they should ginger up. They should engage all, activate. Let's try to improve on collaboration and engagement, because we are all in it.
To find out from you, as a coalition of NGOs in health, to what extent have you engaged medical authorities on this particular issue you have raised?
My sister, we have done our best. There's no institution in Ghana that have done surveys comparable to the coalition of NGOs in health. And if you trace our story from January, we have done 16 surveys. We are happy that government have used most of the surveys, but we think that we are relaxing as a country. Let me give you a typical example. We were the first to come out with a survey to inform the Ministry of Information that please use the local languages in the fight against the COVID. After 3 days, they repackaged, silence the English, and begin to project the local. Find out now from the local language whether it's being used again. That attention has been reduced, but we needed to intensify by now. And in fact, not one jingle. You are not supposed to use one jingle, because you are supposed to be informed by the science and the data. So as we are getting more cases, we cannot use the same jingle to play. We have to use a different strategy in communicating, using the local dialect. So you have the Gare, we have the Bani, we have the Bunsa, we have the Gan, we have the Twi. Even Twi, we have 2 different types of Twi or Tre. So we need to be changing the messages as the science is directing us. But we have played jingle for 3 months now without changing the content. That cannot change behaviors. The other aspect is that we were the first to do a survey, and we wrote a letter to the president, open letter to the president, and we said that if you lift partial lockdown, what it simply means is that you need to intensify the effort being made. You need to double the logistics. And you can trace from your media, we have given you such releases. You need to double up that. Then we also came out on the same platform and told the president that if you are lifting or if you are ending your executive instrument, you cannot go ahead to just lift it without passing another executive instrument for the use of mask and social distancing. It was just 3 days ago that the president officially announced that it is now a law. How many months? More than a month. And so now that it is a law, we hope to see that the necessary logistics should be provided to the Ghana Police Service. The necessary logistics should be provided to the Ghana Health Service Regional Task Force. They will also intend decentralize the logistical support to the district. The third point in our research we recommended is that the ordinary Ghana Health Service will perform creditably if the centers within the areas that government earmarked or the Ministry of Health earmarked are provided with the necessary logistics.
Okay.
My sister, I can give you evidence of districts that have places earmarked for them to be provided with logistics in case of cases, then they can keep both the suspected and infected.
I see.
But you can go there and you find out that the two scenarios do not have the necessary, what do you call it, washrooms.
So the bottom line...
You cannot keep people, two different group of people for them to use one washroom. This is not public health accepted.
Okay.
So it means we are really not supporting the districts to be up and doing and to be really prepared. Right. And that is what we keep on telling government. Every day we have data. Every day we keep on talking. Please, let's support the Ghana Health Service at the district level. They can do the job.
Okay. Dr. Benaku, thank you so much for your time this afternoon. He's the General Secretary of the Ghana, I beg your pardon, he's the chairperson of the Coalition of NGOs in Health, Dr. Gabriel Benaku, joining us this afternoon, raising key issues there as well. He talks about the testing centers that are needed, the fact that testing centers are needed across the country, the fact that we need to understand the science, or government should communicate the science behind the figures that they give us and what the scientists are doing to help change or shape behavioral patterns, and how they have done surveys, several of them, how they actually forewarned a month ago about the need to make wearing of masks mandatory before lifting of restrictions were done.